What we have here is a detailed roadmap for improving food safety in Alberta.
As the final report into the food safety review of the E. coli outbreak at Calgary daycares was released to the public, those Calgary parents who were looking for some answers were given recommendations rather than findings on how the outbreak happened. The panel wasn't actually tasked with furthering the investigation, but rather to come up with suggestions to reform legislation to improve food safety in childcare settings.
The review panel carefully considered every angle of this issue over 7 months. The review panel produced a report with 12 primary recommendations and 27 sub-recommendations for strengthening food safety in Alberta's licensed childcare facilities and the kitchens that serve them.
The recommendations focus on 3 areas: how daycares need to be more transparent with their inspection reports at the centre entrance, and a complaint number for parents, and also requesting anonymous tips on kitchen health violations.
Who are working within a daycare or any kitchen, who are seeing unsafe practices as a matter of general management, they need to feel safe that they can alert the authorities that something's going on where they work and not risk their job.
Secondly, more AHS daycare inspections and penalties for offenders. And lastly, how the government and AHS will tackle outbreaks of this kind in the future. Alberta's health minister saying that the system responsible for food safety is in need of a significant update and reform.
What also was difficult for AHS inspectors to deal with was the fact that there was some of the evidence wasn't preserved that should have or could have been preserved had there been a detailed inspector with a different lens looking at this particular situation.
There's still no clear culprit into the E. coli outbreak from last September that lasted for 51 days with 448 infections at 17 childcare facilities in Calgary. While the food from the central kitchen operated by Fueling Brains is considered the likely source, AHS's Dr. Laura McDougall drawing a possible link between this outbreak and 11 other E. coli cases in the province, some related to uninspected meat.
We were able to identify that 4 of them were in fact had a very recent history of consuming privately sold or privately procured meat. And that's as far as we're able to make that connection.
While work on some of these recommendations has been started immediately, like increasing AHS inspections, others like enforcement and fines needs change in the legislation that will likely come through this fall. In Calgary, Henna Saeed, City News.